Eileen Veilleux The Fam here. Welcome to a new installment in our mental health mini-series. And in this installment, we will be going over body dysmorphic disorder. Before we begin, let me just remind you to please watch the full video because throughout the video, there'll be 3 keywords. When I get to the keyword, I will say keyword and what that keyword is. At the end of the video in the comments section, along with a genuine comment about the video, put in what the 3 keywords are to be eligible for my free merch giveaway when I reach 2,000 subscribers. So, what is body dysmorphic disorder? Well, body dysmorphic disorder is a mental health condition in which you can't stop thinking about one or more perceived keyword defects or flaws in your appearance. A flaw that appears minor or can't be seen by others. But you may feel so embarrassed, ashamed, and anxious that you may avoid many social situations. When you have body dysmorphic disorder, you intensely focus on your appearance and body image. Repeatedly check in the mirror, grooming, or seeking reassurance, sometimes for many hours each day. Your perceived flaw and the repetitive behaviors cause you significant distress and impact your ability to function in your daily life. You may seek out numerous cosmetic procedures to try and fix your perceived flaws. After you may feel temporary satisfaction or a reduction in your stress. But often enough, the anxiety returns and you may resume searching for other ways to fix your perceived flaw. There is some treatment for dysmorphic disorder, which may include cognitive behavioral therapy and medication. We'll go over that later. So what are the symptoms for this? Well, signs and symptoms of body dysmorphic disorder include being extremely preoccupied with a perceived flaw in appearance that to others can't be seen or appears minor. Strong belief that you have a defect in your appearance that makes you ugly or deformed. A belief that others take special notice of your appearance in a negative way or mock you. Engaging in behaviors aimed at fixing or hiding the perceived flaw that are difficult to resist or control, such as frequently checking the mirror, grooming, or skin picking. Attempting to hide perceived flaws with styling, makeup, or clothes. Constantly comparing your appearance with others. Frequently seeking reassurance about your appearance from others. Having perfectionist tendencies. Seeking cosmetic procedures with little satisfaction. And avoiding social situations. Now, preoccupation with your keyword appearance and excessive thoughts and repetitive behaviors can be unwanted, difficult to control, and so time-consuming that they can cause major distress or problems in your social life, work, school, or other areas of functioning. You may have excessively focused over one or more parts of your body. The feature that you focus on may change over time. The most common features people tend to fixate about include the face, such as the nose, complexion, wrinkles, acne, and other blemishes. Hair, such as appearance, thinning, and baldness. Skin and vein appearance, breast size, muscle size and tone, and genitalia. A preoccupation with your body build being too small or not muscular enough occurs almost exclusively in males. Insight about body dysmorphic disorder varies. You may recognize that your beliefs are about your perceived flaws may be excessive or not be true. I think they probably are true. Or be absolutely convinced that they're true. The more convinced you are of your beliefs, the more distress and disruption you may experience in your life. So, when should you see a doctor if you have this? Well, shame and embarrassment about your appearance may keep you from seeking treatment for this. But if you have any signs or symptoms, see your primary care provider or a mental health professional. Body dysmorphic disorder usually doesn't get better on its own. If left untreated, it may get worse over time, leading to anxiety, extensive medical bills, severe depression, and even suicidal thoughts and behavior. So, it's important that if you think you have it, talk to your doctor. You don't have to go with anybody. You can do it privately so nobody else knows. What's so now that we know what causes it, what the signs and symptoms are, what causes this body dysmorphic disorder? Well, let's find out. It's not known specifically what causes body dysmorphic disorder. Like many other mental health conditions, body dysmorphic disorder may result from a combination of issues, such as family history of the disorder, keyword, abnormalities of the brain, and negative evaluations or experiences about your body or self-image. So is there any risk factors involved with this? Well, body dysmorphic disorder typically starts in the early teenage years, and it affects both males and females. Certain factors seem to increase the risk of developing or triggering body dysmorphic disorder, which are having blood relatives with body dysmorphic disorder or OCD. Negative life experiences such as childhood teasing, neglect, or abuse. Certain personality traits such as perfectionism, social pressure or expectations of beauty. Having another mental health condition such as anxiety or depression. So, are there any complications with this disorder? Well, complications that may be caused by or associated with body dysmorphic disorder include, for an example, major depression or other mood disorders, suicide thoughts or behavior, anxiety disorders, including social anxiety disorder, better known as social phobia, OCD, eating disorders, substance misuse, health problems from behaviors such as skin picking, physical pain, or risk of disfigurement due to repeated surgical interventions. So those are all the risk factors. Is there any way we can prevent this? Now, there's no known way to prevent body dysmorphic disorder. However, because body dysmorphic disorder often starts in the early teenage years, identifying this disorder early and starting treatment may be of some benefit. Long-term maintenance treatment may also help prevent a relapse of body dysmorphic disorder symptoms. So that is what body dysmorphic disorder is. So you can see there's many mental health issues out there. Some are minor, some are not. And, that's why I plead with each and every one of you to learn to see with your heart instead of with your eyes. This world would be a much better place if we could all learn to do that. When we see with our eyes, we we become superficial and we start judging just by what we see on the surface. Well, you can't judge a lot of foods that way. Why should we judge people that way? We weren't meant to judge each other. In reality, and this has been a proven fact, when we encourage, inspire, and uplift people, okay, we release endorphins in our body. These endorphins heal us, make us feel better. I mean, they're better for our body. But when we have a negative approach instead of a positive, and we cut somebody down, tease them, or we're mean in any shape, form, or matter, we release toxins inside of our body that make us sick, unhappy, and miserable. And it has been proven this is the way we were created. So we were created in essence to be with other people, to help other people. Because when we do that, we're helping ourselves by releasing these endorphins in our body. When we don't do that and we're the opposite, we release toxins in our bodies that make us sick. So, it is very important to see with the heart and not with the eyes. The eyes are here to see beauty, yes. But beauty is also in the eyes of the beholder. Who are you or I to tell somebody they're ugly, they're fat? We have no place to say that. We have no place, okay, if somebody says something we don't understand, don't say another victim of this person or this person's bad. Okay, we don't know what's going on in their life. So we have no place to judge. We're no better than them. We may be better in a lot of different areas, but they may be better than us. It's simply if somebody, whether it's online or offline, any type of social media or out in the world, if somebody annoys you, be the better person. Say let them know in a loving way, and I don't mean kissy huggy type loving, I mean in a nice way. And simply tell them, look, this isn't, I don't know what's going on, and explain to them. And if that doesn't work at that point, you don't have to cuss them out. You don't have to make a big issue all over social media and YouTube and everything. Just go your separate ways. Sometimes that's what it is. We're not, sometimes it's okay to disagree. And if you can't get along, sometimes it's better to just walk away. Drama does not help anybody. It doesn't help you, and it doesn't help anybody else. So to remember, until we see each other again, remember, I'm getting up close and personal. Yes, I'm talking to you. That's why I'm close. You all matter to me, each and every one of you. Why? Because you were put here for a reason. And that reason is not for me to judge you, but to uplift you, encourage you, and inspire you. Okay? Because we are people. We were made to need each other, to be with each other. Okay? We were not meant to be alone or solitude. That's why you're important. Your life matters to me. Every life matters to me. I don't care if you're fat, skinny, tall. I don't care if you're purple, black, or yellow polka dot. I love you for what's inside. What's in here? The heart. That's where I go by. And that's why you're important. So until I see you again, remember that. And always see with your heart and not your eyes. I love you. Bye.